What's up, awesome people? My name is Eunistes and you're welcome back to my YouTube channel. In this video we are going together for my dental appointment at Alexandra Medical Centre.
Hi, my name is Dr. Hannington Balidawa. I'm one of the dentists at Alexandra Medical Centre, and I'll walk you through briefly what usually happens when our patients walk in, especially in times like this. First of all, irrespective of my association with the patient, I would want to assume all the protocol that I'll have my PPE on. So we always have a mask, and in most cases we are trying to use a single mask per patient. And usually when you walk in, as the patient comes in, after screening at the main reception, whereby when the patient comes in from the main reception, they have done their temperature and they have followed through the usual protocol of screening temperature-wise and also washing hands and sanitizing. And then before we go on with any treatment, we ask them to rinse with a mouthwash. Mainly it is betadine. It is like a surgical scrub. So I'll ask you to kindly, that's for you to rinse. So you will sit, you rinse that in your mouth, you hold it in for about a minute while you swirl it around. Yeah, it's a little. I'm sure you will take more wine than that, given the opportunity. So you don't swallow, you just hold it. The essence behind the mouth rinse is to reduce the viral load in the mouth, so that in the event that you are going to see the patient, you have reduced on the viral load in the mouth, and in case you have what you call the debris that are, or aerosols, you do not have so much that you are getting into your own mouth. What can I do for you today?
I need to shave my last tooth beside.
Oh, you're being very honest. What happened with the last tooth behind?
When I take food and it's either too hot or too cold, then I feel a little bit of pain. Whatever food I take, it affects the last tooth.
So usually in the dental setup or in medicine, history is the main bit about diagnosis. So, can I go ahead? So you cannot do much without taking the patient history. So usually you put the patient in what we call the supine or examination position. The patient has finished rinsing, so you are in a place to assume that there is less viral load in the mouth. The patient is not sneezing, so I presume if there is any form of infection, I am happy to believe possibly it has not gotten to the place of being very infected. So yes, I have not seen any signs that they worry me. Usually these are sterilized instruments, and these are pre-packed in the pre-packed sterilization pouches. So as I explained to you with the loops, I can be able to examine from afar, but see very close. I have this distance, yeah? I can open a bit. Lift up the chin a bit more. Yeah, turn a bit towards me. So from here, I am able to see so much. I can see where our culprit is, somewhere here and somewhere here. We have some cavities. And yeah, we have some cavities here. Okay. So this is called a mirror, this is a probe, and this is a tweezer. This is a full examination kit. The mirror is for me to be able to have a reflection of what's in the mouth. The probe is for me to run around the different areas of the tooth. And the tweezer usually is just for holding cotton or, yeah, without necessarily using my patient's mouth. And from the examination, we discuss the treatment options. Treatment options are variable based on what the patient has presented with. Usually after the examination, you want the patient to sit in a normal position so that you don't talk as when they are lying, they feel vulnerable. That everything they say, you just say yes, they just say yes. But when they get back to the more sitting position, they are more in a position to discuss what can we do and what we're going to do. In the event that you have a hole on your tooth, or what is commonly referred to as a cavity, there are levels of cavities and their positions, but so I will not go so much into the technical descriptions.
Yeah.
But when you have a hole on a tooth, especially these are permanent teeth, let us say, we look at taking away the decay in that area, clean it out well, make it, shape it in a way that it is retentive, that whatever I'm going to be there, put there, can be retained. Okay, so that's what they call the cavity preparation design. And then fill it up with the cement. So that is the basic about a filling. There are different kinds of cements. There are people who are very fussy and they would say, oh, I prefer the white cement, which has been the advocation now going on all around the globe, that people do not want the gray fillings, like mine. But these have been there since 500 AD, and I think my former boss one time examined a patient who was in World War, and they had the filling done in the World War II and was still there. So these have stood the test of time, and they surely will be able to work perfectly. But out of preference, we go ahead and do the white fillings, which if you do a white filling, especially on the back teeth, you would encourage your patient to come back maybe every year for a regular checkup, because those have a tendency of what they call micro leakage. If micro leakage occurs, there's a possibility of decay under the filling that has been done. Here at Alexandra, we are doing almost everything in dentistry. We are seeing all age groups, from children to adults. We are doing preventive dentistry. We are doing management dentistry in terms of conservative. We are filling cavities. We are doing root canals. We are doing crown and bridge work. We are doing dentures. But also recently, not recently as us, but recently the treatment modality for teeth replacement has been dental implants. And so yes, we are doing a lot of dental implants.
Thank you so much for watching my video, and of course I'm going to update you the next time that I come back for my teeth to be filled.